Hi, my name is Jenna Sleeman, and my research report is on the effectiveness of horticulture therapy in older patients with dementia, a meta-analysis systemic review, published in the Journal of Clinical Nursing, September 14, 2024. In reviewing the article, the research question is, can horticulture therapy improve cognitive function, mood, daily living activities, and the quality of life in dementia patients compared to conventional care? The eligibility criteria of the Chinese and English published studies were that they looked at men and women 60 years or older that had dementia. These studies were mainly in China, Italy, or France, and the patients were in nursing homes, aged care hospitals, care homes, or private residences. The two researchers used studies that were published up to November 2023. The two investigators, if they had a conflict, they hired an external consultant that helped narrow down the cases to 655 dementia patients from the collected 6,703 randomized control articles. The instruments they used in cognition were the Mini Mental State Examination, the Montreal Cognitive Assessment in Depression, the Cornell Scale and the Hamilton Depression Rating Scale, Daily Living, the Barthel Index, and the Activities Daily Living, and in Quality of Life, they used the Quality of Life Scale for Alzheimer's disease. When reviewing the evidence, the key findings were that when dementia patients had horticulture therapy, they had a significant increase in cognitive function, especially when they had it twice a week. Additionally, they had a reduced depression and a significant increase in higher quality of life and a significant increase in better daily living activities in China, Italy, whether they were in a care home or a nursing home or an aged care hospital. The best outcome for horticulture therapy classes for dementia patients is when it's less than 6 months, when it's greater than 60 minutes, when it's outdoors, structured, and it's more than twice a week. The researchers' key findings were that horticulture therapy has a significant impact on improving cognitive function, decreasing depression, enhancing activities of daily living, and significant impact on improving the overall quality of life. There were a few study limitations, one being there was a disproportionate demographics because they only looked at English and Chinese studies. If there was any other study in any other language, they could have missed that. So results may not have fully applied globally. Also, it was a small sample size of 655. When you look at the World Alzheimer's Report, there's 46.8 million individuals globally that suffer from this condition. The authors of the study concluded that horticulture therapy is a safe, non-pharmacological intervention that can meaningfully improve cognitive, emotional, and functional outcomes in older patients with dementia. Future research should include larger, high-quality, global randomized controlled trials to strengthen evidence and guide healthcare implementation. Thank you so much.